Did you know that women are 3 times more likely to develop multiple sclerosis, commonly known as MS, than men? And if you're African American, you could have a greater chance of developing progressive symptoms, according to the Multiple Sclerosis Association of America. A new public service announcement is raising awareness of MS in the black community and encouraging African Americans with MS to advocate for their own health. The PSA features poet Azure Antoinette, who lives with MS, and she's here with us today, live from Los Angeles, alongside neurologist and MS specialist Dr. Mitzi Joi Williams. Thank you both for joining me today.
Thanks for having us.
Thank you so much.
Now, first, doctor, can you tell us more about the symptoms of MS and what are some early warning signs that your patients have shared and that people should be looking out for?
Absolutely. So MS is what we call an autoimmune disease, and the nerves are attacked by the immune system with MS, and that's what results in the symptoms that we see. For some people, it can be loss of vision. For others, it may be difficulty walking or weakness in their arms or legs, and still others may have numbness or tingling. Other symptoms that we commonly see are what we call silent symptoms of MS, such as fatigue, which interferes with their daily activities, as well as cognitive dysfunction or difficulty thinking. In terms of warning signs, these are the regular symptoms of MS, but it could be a warning sign because the symptoms often go away in the beginning. So if someone has a numbness that goes away after a week or so, that could be a warning symptom of MS versus another condition.
Thank you so much for sharing that with us. Now, MS is actually something that's very close to my heart. One of my very best friends who I went to high school with and college with, she developed MS in her very early 20s and unfortunately lost her life to the disease. So I want to thank you so much for spreading more awareness of this disease. Now, please tell us, how does the MS experience for African Americans different from other patient populations?
So the MS experience differs in that there's some symptoms that are a little bit more common, such as visual problems and difficulty walking. But more importantly, we see more severe outcomes, such as more disability with walking over time. We also can see in some studies that people who live with MS in the Black community may die at younger ages because of more severe disability. And I know that Azure has shared some of her story, and similar to your friend, did have symptoms starting in her early 20s and was diagnosed in her late 20s.
Yes, indeed. Now, Azure, please share your story with us. I know that things have progressed a very long way in terms of research and development for management of MS over the years from when my friend passed away, and she was African American as well. So tell us about your journey with MS.
Sure. Well, firstly, I'm sorry to hear about the passing of your friend. My thoughts go out with you. There's never the loss of someone never really dissipates. So my condolences to you. My journey with MS started in my early 20s. I experienced, cognitive decline. Like Dr. Williams was saying, fatigue, extreme fatigue, just a very sudden onset, extremity difficulties, dizziness, vertigo. Once I fell down a flight of stairs, couldn't even remember how I'd gotten to the bottom. But all of it was so sudden and sporadic. Sometimes it would go on for a long time and then it would just go away. And sometimes you couldn't see it at all. All I knew is that I was too young for any of that to be happening, and I didn't know how to talk about it. And I was too young, and all of my peers and friends just thought I was flaky and was disinterested. So it started to feel shameful and embarrassing. And I didn't even have medical insurance at the time. So it just felt like, I didn't have enough information, and I didn't have any empowerment, and there was no visibility or representation around the disease itself. And I didn't know what it was. It wasn't until I lost my ability to walk at 28 that, after several visits to different emergency rooms, that I was able to get a diagnosis. And even after that, it wasn't an immediate journey to wellness. It wasn't some, light switch didn't go on immediately after that. It's taken a lot of time for me to figure out how to manage and manicure something that works for me. And there is not a one size fits all to this disease. The reason that I said yes to this campaign, the reason that I said yes to being an advocate and front facing for the PSA, for more2ms.com, for this documentary, for partnering with Dr. Williams, is because there are too many people being lost to autoimmune diseases, to their silence, to feeling like they are by themselves, to a lack of community, especially in the Black space. It is important that we know that our health matters just as much as our lives matter. So, today it is about the launch of this beautiful documentary, because it is about the stories of myself and others like me that are not just living with this disease, but thriving. It is about the honor that we want to pay to people like your friend that passed, that didn't have the time and the resources and the community that needed to be with her and standing and gathering around her to support her. So this is what this campaign is about. This is exactly why we're here today, is to make sure that people know that there is help out there, that there are practitioners that are standing in their corner, like Dr. Williams and her office, that are going to be and sit with you and want to know what works out. So go as soon as you can to more2ms.com. Find out how you can get involved. Look at the stories of us all over the United States of America living and thriving with this disease. Check out the PSA, check out the documentary, reach out. We want to hear from you. We'll be there waiting. And I'm excited to see this get more representation and more agency. And thank you for having us. Thank you for sharing your story with us as well. And we can't wait to see what else we can come up with. Thank you again.
Absolutely, and thank you for sharing your journey with us. Now, for both of you, one final question. What advice do you both have for patients who are currently right now living with MS and are trying to advocate for their health, and especially you, doctor? What advice do you have for patients to speak out more about their MS, especially the fatigue that comes with it?
Yeah, so absolutely, don't be afraid to share your story, and don't be afraid to ask for help. I think one of the things that's most difficult, especially for those in the Black community that are used to being strong and holding things in, is to make sure that we're not afraid to ask for help and share with others what we're going through. And again, advocate for yourself and educate yourself. View the documentary and hear the wonderful stories of Azure and others who are MS warriors and thriving with this disease. And we're so excited to be a part of it. And thank you so much. Go to more2ms.com to check that out and for more information. And we appreciate you highlighting this important information today.
Thank you so much.
Thank you. And you're very welcome. And again, that's more2ms.com. You can see Azure's story there, as well as get all the information you need to advocate for yourself for living with MS, as well as caretakers as well. Caretakers, family, friends, anyone. If you have someone in your life who's living with MS, please go to this website so that you can get a better understanding of what they are going through and how you can help them emotionally, physically, even mentally, because their mental health is very important as well. Go to more2ms.com and watch the documentary. It will definitely give you more insight, so that way you can be a better advocate for yourself or for someone you love. I want to thank you both so much again for joining me today. Azure, I wish you the very best in the years to come.
Thank you.
And again, thank you, Dr. Williams, for joining us today.
Thanks
Absolutely.
so much. You take
Our
care
pleasure.
of yourself.
Have a wonderful day.
Thanks,
Thank
you
you,
too.
you
Bye-bye.
too.